Hi, my name is Emma Palmieri, and today I will be talking about bias in epidemiologic studies. When we talk about bias in epidemiology, we're talking about systemic errors that distort study results. Bias can occur at any stage, from how participants are selected to how data are collected or even interpreted. It's important to recognize bias because it threatens the validity of our findings and can lead researchers to incorrect conclusions about associations between exposures and outcomes. The first one I'm going to cover is the Hawthorne effect. The Hawthorne effect happens when individuals modify their behavior simply because they know they're being studied. For example, factory workers in an observational study might start working harder because they're aware researchers are watching them, not because of the intervention itself. This can make an intervention seem effective when, in reality, the change was just due to awareness of observation. Next is recall bias. Recall bias occurs when participants remember past events inaccurately. This often happens in case control studies where people with a disease may think harder about past exposures than those without it. For instance, mothers of children with birth defects might recall more details about their pregnancy or medication use than mothers of healthy children. This difference in memory can distort the apparent link between exposure and outcome. Next is selection bias. Selection bias happens when the people included in a study are not representative of the population that you are trying to study. For example, if a survey on a diet and heart health only include people who volunteer at a gym, the results may not apply to the general public. The samples are already skewed toward healthier individuals, which leads to misleading conclusions about the effects of diet. Next is the healthy worker effect. The healthy worker effect is a type of selection bias that appears in occupational studies. It occurs because employed people are generally healthier than the overall population. For instance, if researchers compare factory workers to the general population, the workers may seem to have fewer illnesses, not because their jobs are safe, but because people too sick to work aren't included in the study. Lastly, our confounding bias. Confounding happens when a third variable is linked to both the exposure and the outcome, making it seem like there's a direct relationship when there really isn't. For example, if we find that coffee drinkers have higher rates of lung cancer, we might assume coffee is to blame. But if coffee drinkers are also more likely to smoke, smoking is the real cause. It's the confounder. Researchers can control for confounding through randomization, matching, or statistical adjustments. In summary, recognizing different types of bias is essential to interpreting research correctly. No study is perfect, but understanding where bias might occur helps us to evaluate findings more critically and improve the design of future studies.